The camera was the animal would actually start to move. And I think that's so amazing. It would be children can walk around, a bit like a treasure hunt or something like that, and be able to, the parent can help
What is HEAL? The Healthcare Excellence Accelerator Lab is a collaboration hub, co-led by the QUT Design Lab and the Healthcare Improvement Unit at Clinical Excellence Queensland. HEAL is designed to act as a bridge between QUT Design, the innovation community, and Queensland Health, accelerating healthcare improvement efforts across the state. The HEAL project includes 16 different projects in locations across Queensland. From Brisbane to Cairns, 10 QUT Design Lab members form the core HEAL team, bringing together expertise in inclusive design, participatory and co-design methodologies, design thinking, and design-led innovation.
I'm Yvonne Miller, Professor of Design Psychology, Director of the QUT Design Lab and Co-Director of HEAL, the Healthcare Excellence Accelerator Lab. For the last year, I've been privileged to work with Queensland Health to put designers, design thinking, design doing, design visualisation and design futuring, the energy and the creative spirit and the innovation behind design into hospitals across the state. So healthcare in Australia is under pressure. We know that we've got an ageing population, the growth in chronic diseases, underutilisation of primary care. We need to provide better services to our First Nation consumers. How do we do that? How do we do that efficiently? How do we provide value-based care that's sustainable, that's agile? How do we improve the system? These are challenges that all healthcare organisations are working towards, but very few are using a design approach or a design-led approach that kind of risk-taking, that kind of the way of viewing the world and a problem in a different way. That's what design brings to a problem, and it's what healthcare needs.
Because we are such a transdisciplinary group of staff within the Design Lab, we have a really great approach to projects like the projects we work with HEAL and Queensland Health, because we can come from it from a lens of all different disciplines. Instead, we start from the ground and we work together to see how we could initiate change and how we can do that together as a process instead of, being in our own separate silos. So that's really what HEAL's all about, is co-designing from the ground up. It's looking at the whole problem together from the beginning.
So with Sunshine Coast University Hospital and Children's Queensland Hospital, we started investigating PPE for pediatric care in a way that it does help and support the therapeutic relationship and the rapport building between clinicians, nurses, the parents, and the child patient.
Challenges that the clinicians and the healthcare professionals have with their current PPE is, firstly, it covers up a lot of their face, so the emotional expressions and the way that they usually engage with, especially children, is blocked, especially around the issues that the healthcare professionals had last year when they had to wear a lot of PPE in that situation. And that covered up a lot of their face and a lot of the ways that they used to engage and express with children in that context.
So as designers, we find that we work really conceptually, and we work with a lot of different ideas and thoughts on different materials and how things can come together. And sometimes working with the medical professionals, they don't necessarily see the connections that we do. So once we develop the prototypes and have the visuals to show them, they all get really excited and are looking forward to see more and share more of their ideas.
So working with children and pain, obviously as designers we can't solve all the problems straight away. And for that we focus specifically on a smaller injury, which was the wrist injury. With children, when they hurt their arm or their hand, they become really protective. And going to a stranger, they definitely do not just want to give their hand to you to assess. So what we've designed is a device that the child can familiarise themselves with, and at the same time it gives the clinician some time to engage with the child and make them feel safe.
After my first clinic on Thursday Island, and I saw the infrastructure from Queensland Health that you can actually do telehealth clinics, came to my mind that how about if we can integrate the care through telehealth? MDT improves patient outcomes. How about we just use telehealth, existing telehealth? At the end of the day, the gold standard, if you ask a clinician, the best practice is having patient in front of you. But what COVID did to us, or everyone, is took away that reachability and the visibility of the patient.
When we're thinking about voice, and we're thinking about a new clinic, and we're deep into the how's this going to work, we think about the period of the patient encounter with the clinicians, primarily. And that process really forced us to focus on how do we support the patient from the first time we contact them to say, hey, how about a voice clinic instead of coming into the hospital.
Doing things like something like a future workshop was fantastic because you're really being a slightly provocative. You're getting them to think about, 10 years in the future, what does healthcare look like? But really what you're trying to discover there is what their ambitions are for their own healthcare experience, what they want their lifestyle to look like, and how we can embed that into services now.
I'm Manuela Taboada. I'm a senior lecturer here at QUT, and this project is about cultural safety in Queensland hospitals. It's hard to feel comfortable in hospitals, and First Nation Australians feel even more discomfortable because most of the times they feel culturally unsafe in those environments. But also the other side of this is that clinicians also feel uncomfortable sometimes when treating First Nations patients. So in this project, we set out to create an animation video to improve awareness of the biases that we have in ourselves and that might create a barrier of treatment for our First Nations patients in hospitals.
From these examples, you can see HEAL is designed to connect healthcare professionals across Queensland with designers who will work together and use design approaches to transform thinking, spaces, places, and products. Positively transforming healthcare.